TENS units, what they do is they're for your patients that have a chronic pain. They've tried medication, they've tried physical therapy, they've tried all different things, and it won't alleviate the pain that they have. A TENS unit, it attaches, it's a pretty simple device for the patient to use. What it has is it has the unit itself, it's got lead wires, there's 2 sets of those, so the wires attach right in here, and right in here, and then it has pads that attach. These pads are pretty universal, so it doesn't matter which one goes into which pad, which tube goes into which pad. Oops. These pads are reusable and can be placed anywhere on the body that the patient feels pain. Of course, this needs to be a place that the doctor has prescribed the TENS unit for. The pads just peel off and put onto the body. These pads are used about a month at a time. What we recommend in order to keep the stickiness through the month is that where the pain is at, you wipe down with an alcohol, let it dry, and then put the pad on there. Once you're done using it, you just replace the pad to the backing. So the way the TENS unit works is you have to turn on right here, and right here what this does, if you can see these numbers on here, what it does is it tells you the strength of the pain, or the strength of the pulse. It's 1 to 8. Both of these knobs have to be on in order for the unit to work. If you only want to use it on one side of the body, you can keep it at 1 and adjust maybe the right side or the left side depending on where your pain is at, but they both have to be on. Right here, it has the screen that tells you, right now I have them at the same one, but it's got the mode, so it tells you, you can set it. So this is the intensity of it, so the duration, so if you want it in a pulsating form, if you want it longer. This is for the length of it, so if you want it to be deeper, then this is going to be the mode that does that. A TENS unit, in order to get covered through insurance, Medicare is a little bit complicated on this. So the unit itself, you have to get a prescription. Once you have the prescription from the doctor, we have to get supporting chart notes. With Medicare, the patient cannot have lower back pain. If the patient needs the TENS unit for lower back pain, the patient needs to be seen by a pain specialist doctor and enroll in a Medicare-approved year-long pain study. Once the patient has done that, then we can start the process in getting them approved for a TENS unit. With that, we need chart notes that state where the patient is in pain at, how long the patient has been in pain, a list of their medication, what has been tried and failed for the patient. If the patient has not tried medication or has not tried physical therapy, then they need to try that before they come to the TENS unit.